Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Hello, everybody. Thank you so much for joining me again this week here on MS&Me Radio. My name is Anisha, otherwise known as MS Veteran or Chocolate Nams. By this point, it's okay if you guys call me Chocolate Nams. Thank you guys so much for tuning in with me again this week. This week we're going to talk about something that's a little bit controversial here for the first part. I want to make sure to give some clarity, I guess, so to speak, because it is a question that a lot of people ask this time of year, and I've seen it a lot, and many people aren't sure. So I'm just going to take it head on for this first part of the show, and then for the second part, we're going to talk about something else. So we'll transition, and again, I'm going to go squirrel, as I always do, like I just did. I lost my train of thought, but squirrel, rewind, let's go back. What we're going to talk about right now is the flu shot. Right? So many people ask, do I get the flu shot? Should I get the flu shot? I've heard so much about the flu shot. What should I do? Blah, blah, blah. Okay, that's a great question. That is honestly a great question. And I see it so much that I honestly decided that I would take it on here this week on my show. So with the flu shot, the shot, when people get the shot actually in the arm, that is inactive, okay? In other words, it's the dead virus, okay? That is one that people with MS should get. And I'll go into a little more detail here in a little bit, okay? Now, for 2017, 2018, the inactivated seasonal flu immunization, it is recommended by the CDC, which is the Center for Disease Control and Prevention, for everyone over the age of 6 months old. The seasonal flu vaccine has been studied extensively in people with multiple sclerosis. So we want you guys to know that it has been studied extensively over many, many years. And it is considered quite safe, regardless of the disease-modifying drug that an MS patient may be taking. Now, there is an exception to that, okay? The exception is MS patients that are being treated with the disease-modifying therapy Lemtrada. They should be given the shot 6 weeks before receiving their Lemtrada infusion, okay? So if you're a Lemtrada if you're an MSer receiving Lemtrada as your disease-modifying therapy, you should receive your flu shot 6 weeks before you get your Lemtrada infusion, okay? And again, the 2017 and 2018 inactivated seasonal flu shot it's manufactured by several different companies under different brand names, okay? And again, when you hear that inactive, that's dead, that's going to be the flu shot, okay? Now, I want to clarify something for people that many people don't know. Now, the nasal mist that people get in as opposed to the flu shot, but that nasal mist is also for the flu. That's an active virus. It's a live virus. So anyone with MS and anyone in your household, your kids, your caregivers, anyone that lives with you, any member of your household should not receive the nasal mist, okay? If they live in your home with you, everyone should receive the shot, which is inactive, okay? That's very important for people to know. Because again, that nasal mist, it is the active virus, okay? Another thing that's important is to getting vaccinated before flu season begins. That's honestly the most effective way to prevent yourself from getting the flu. For this reason, the CDC always recommends that people get the flu vaccination by the end of October. That's if possible, because again, sometimes we all know that they'll get them in, then they'll run out. They have to get more back in. But also by talking to your doctor, because when you're someone that has a chronic illness, you're immunocompromised, things of that nature, you're normally categorized a little bit different and can receive your shot ahead of time, okay? In order to prevent you from being sick, just make sure that you're letting your doctor know and you're discussing with your doctor if he feels that it is something that you should take, and seeing about getting you in that right schedule to do so, okay? Again, discussing this with your doctor is a very good thing, because your doctor too would be happy to know that you're learning all this great information that the CDC is recommending as well with MS. And again, that even if you can't get it by the end of October, if you get it later on, it can still be beneficial to you. It doesn't mean like, oh my gosh, I didn't get it by, just know that as long as you get it, it can still be, beneficial. And the CDC also recommends that the flu vaccination be that you take it, because the influenza viruses, they are circulating. So in this circulation can take place even into January or later, okay? So it just really, a lot of things are like weather contingent and all of that. So keep that in mind, that sometimes flu seasons are short-lived and sometimes they're very long-lived, okay? So the best thing that you can do is talk with your doctor about it and let them know what the CDC recommends, and that you see about getting it. Now, a lot of people will say, I got the flu shot one time and I got so sick. Now, that's usually, in a lot of ways, it's a myth, okay? What has happened is that you've been exposed to the flu and it just happened to fall in that right time that you ended up getting that shot. Somewhere before that, you hit that inoculation period where you were exposed to it, and it just so happened that you got that shot and then you ended up getting sick. It's not from the shot, it's because you already were exposed to it, okay? And it could have been that your exposure came that day that you went to go get the shot. There could have been someone there, that was sick, that was getting, you touched a doorknob or anything of that nature, and that's actually what ended up getting you sick, because the flu shot, it is inactive. It is a dead virus, okay? Also, too, according to the American Academy of Neurology, it should be considered for MSers with compromised pulmonary function to receive the pneumococcal vaccination, okay? And that's the vaccine against pneumonia. Every time I see that word, it makes me laugh, because, pneumonia is a really hard word to spell. It's kind of like that when you see the word knife, you're like, okay, so why is that K in front of that? Is it knife? I remember being little like, knife? No, honey, it's knife, that P is very silent there in pneumonia, so I often get tickled. That's one of the complex things about the English language sometimes, and those little letters that are silent. But it is recommended for people, or it should be considered and recommended for MSers with compromised pulmonary function. That means that you could have some comorbidity like asthma, allergies, things of that nature that causes your pulmonary function is decreased. That way you definitely would want to talk to your doctor about receiving the pneumococcal vaccination, which is for pneumonia. So it's like you get a shot, and then like a year later you'll get a booster for it. Okay. And I must say that my arm always feels, yeah, after I get it. It's kind of like I've been working out for a really long time. The arm gets a little bit tender, not too bad, but it's a little tough. But also too, for those patients with MS that are wheelchair, or that are in a wheelchair, excuse me, or on a full-time basis, or they are bed bound, those patients definitely want to consider receiving the pneumococcal vaccination and its boosters. Okay. These are things that are very important because, I mean, honestly, you'll see, because again, it all goes back to kind of quality of life. You don't want to stay kind of locked up in your house for, from October until maybe March, when flu season is over with. And again, sometimes in life, if things are going to happen, they're going to happen anyway. But, there are some preventative measures that you can take because that flu shot, it usually takes care of 3 to 4 different strains of the flu. So sometimes if people do end up still getting the flu, it's because it's a different strain that person has contracted, because, you never know kind of what's gonna develop from what last year or the year before last or whatever. It could be something that's a little more super, but it definitely could decrease the amount of time or the intensity of the flu, that course of the flu that someone does get. Okay. So I definitely hope that helps to kind of clear up some stuff with people. And again, it's something that you absolutely need to discuss with your doctor. Okay. Let your doctor know that, hey, I want to know, because again, peer-to-peer support is great. It really is. But also what we're big about is the accuracy, of the information that you receive. We're very big about that here with MS&Me and also the Multiple Sclerosis Global Support Network. We're very big about that. We're very big about you being your own best advocate and talking with your doctors about things and, looking up stuff, with the Center of Disease Control and also the American Academy of Neurology, looking these things up so that you know about it. So that way you can be like a great advocate for yourself whenever you talk with your doctor about these things, because definitely we want for you to make sure that every little, piece of tool that you can have in your toolkit, to make it easy for yourself, that you have it. Okay. And again, I would never be one to tell you don't listen to your doctor, because again, your doctor's going to know your history better than I do. But I definitely will tell you what the CDC recommends, what the American Academy of Neurology recommends. I will also tell you what my doctors recommend. I've gotten the flu shot every year, for many years. Okay. And even with my disease modifying therapy, I still, receive the flu shot. And I've been very, very, fortunate that I haven't gotten the flu. I have had pneumonia. But, that was some man-made thing that my body decided it was going to do. Okay. It was kind of crazy. But honestly, it was because of stress. I got really stressed out and ended up getting pneumonia. But, again, it's very important about, being your own best advocate and talking with your doctor, because guess what? Flu season is approaching. We definitely know 100% fact you do not want to ever receive the nasal mist. Okay, because that is active. Anyone that is in your household, that you live with, they should not receive the nasal mist either, because again, it is active. Everyone needs, you as the patient and everyone in your household, they need to receive the shot, which is the inactive. Okay. And the best thing to do too is for everyone to kind of get coordinated and to get them at the same time, meaning around, if you guys can all go to whatever pharmacy, or I'm not going to give a plug for a pharmacy. I'm not going to do that right now, but if you can go somewhere and you all get them done, that would be awesome. And make sure that you run it past your doctor, give the doctor's office a call, whatever the case may be. But again, I want to make sure that you guys are getting accurate information, because again, sometimes with the whole peer-to-peer thing, it can be a little rough, and we'll tend to not want to listen to what our doctors say when there's actual factual clinical research out here to support what it is that our doctor is saying. But we'll kind of want to listen to our friend, because they're saying it, or it's somebody in a group and there was 10 people out of a group or something that said, oh, well, no, I don't get it, so we don't want you to do that. By all means, talk to your doctor, and anything that has been given right now, you can look it up. It is all research. Okay. And again, the American Academy of Neurology, also the Center for Disease Control and Prevention, that's where this information comes from, because definitely don't want to see any of you guys get under the weather, because it does take us a very long time to bounce back. Okay. Alrighty. Now, the next thing I'm going to talk about, because last week I hit pseudo exacerbations. We talked about that, and the meaning of that, and how it seems one way very negative, but it's actually not. Okay, so this week I want to spend the rest of this time talking to you guys about relapses, and just kind of staying positive within it. Okay, now I will be the first to tell you that relapses are hard. They are very hard. It is very scary, because, with relapses, a lot of times you notice a loss in function of different things. You notice, maybe a leg is dragging, a arm isn't, moving as well, a hand isn't moving as well. It's more, difficult to walk. It's more difficult to get around. Just your energy level itself is, pretty poor. A general malaise feeling all around, just tired. I want you guys to know that there's things, trying to keep a positive attitude. Now, don't get me wrong. I am not sitting here telling y'all to go and, oh my God, no, because I get it. I completely understand. Okay. But again, going back a few shows, plug, hunt the good stuff. Okay. Hunt the good stuff. Look at those, positive things, something that can make you smile, make you happy, within it, because I know that it is hard, and to realize that, nothing good or bad in this life lasts forever. Okay. So it's about doing everything that you can do, in the course of the relapse and after, to maximize your healing or even your function. Okay. Now, with that being said, steroids, okay, they're a beast. A lot of people, when they're in a relapse, they'll receive anywhere from 3 to 7. Yes, I have had up to 7 rounds of steroids at a time. That's a beast, man. It's a beast. Steroids for me have to be ran in very slow, because if they run it in really fast, I become like baby Hulk. I'm angry, okay? Mad. I can eat anywhere from paint chips to, silverware. I will eat anything. I'm just starving. Okay. Steroids are no joke. The swelling and everything that comes along with it, the moon face, all that. Steroids are a very tough thing to deal with. Now, with that being said, it's also to understand too that even though you have unplugged from those steroids in those 3 days of steroids, or 5 days, or 7 days, whatever that course is of IV steroids, or even if it's a taper down dose that your doctor chooses to use, because some doctors now are getting away with, or going away from using the taper down dose off of the steroids. Okay. So for some people, they get like the 5 days and then that's it. Okay. So, just know that that's difficult. Okay. But what's important for you to remember is that if you have any loss of function, if your doctor, because let's face it, we're not their only patient, they could be busy, and we want to be our own best advocate, and we want to work with our doctors. We want to work right along with them, just in case there's some loss of function and they haven't mentioned it. Make sure that you bring up to them that you need physical therapy or occupational therapy or both, okay? You need PT, you need OT, or you need both. It is very important that you do that, because sometimes we feel great after the steroids, there, because you got a little bit of a buzz, you're feeling good, and then the next thing you know, bam, you're like, oh man, I'm not feeling good. Like I kind of still feel just like I did before. That's because those steroids kind of work their course, and you don't want to miss that window. Okay, that window for you to get back as much of that function as you possibly can in order to maintain it. So that's why it's important for you too, if you see or that in this relapse that you're having, that you have some loss of function, that if they have not brought it up, please feel free to say to your doctor, hey, sir, ma'am, doc, could you please put me in physical therapy or occupational therapy or both, okay? So that they can work with you and make sure to get that done. Now, physical therapy, it is painful. I get it. It is very painful. It's something that I kind of, begrudgingly, do myself sometimes, but guess what? At the end of the day, it's to help you keep that function and then figure out what your new normal is, so that you'll know how to live and function within that. Okay, I know it's tough, I know it's hard, but you know what? This is about you getting maximum function out of everything, because it goes without saying, if you don't lose it, if you don't use it, you will lose it. There you go. Excuse me, somewhere I didn't use my brain, because them words just almost just crossed each other. But yeah, if you don't use it, you'll lose it. So yes, PT, OT, it is painful. That's even if you've had an injury and you're going through occupational therapy or physical therapy. It's not the most fun thing to do, but you know what? You want to be able to get range of motion, all of that. You want to be able to get that back up, because through a relapse, if you're walking with a limp, or you have a leg that is dragging, guess what? You are changing your whole stature, okay, to be able to carry your own body. Your entire stature is changing. So that means you're also throwing your back out of alignment. You could be throwing your hips out of alignment. So then you're going to end up with more pain, okay, if you continue to do that. So that's why it's so important for you to get to physical therapy, or occupational therapy, or both, okay, to help you as you get through it, okay? Because the steroids, that's just not, the end, of the journey past the relapse, okay? That's what's important for people to realize. Sometimes if it's things like you're majorly dizzy, or you're, that kind of thing, yeah, you just got to wait for those steroids to kind of calm those things down. But if you've got loss of function with limbs and stuff like that, those steroids, that's not the end of that, okay? PT and OT, if your doctor hasn't mentioned it, by all means, feel free to mention that to them, okay? And hey, they'll appreciate it, because guess what? They will realize too that you are a very compliant patient and you're doing the best that you can with what you have to try to get through it, and they totally will appreciate that, okay? Also too, I feel it's important for family members to know as well. And it's, sorry y'all, I'm going squirrel here for a minute because I almost forgot a point. Sorry about that. Y'all know it happens one time a week, okay? This time it's two. But I gotta backtrack a little bit, because it kind of is twofold. But dang it, don't you wish I'd just say it right? I do too. Okay, let me go back to the flu for a minute. It's also very important that if you have your friends, your family members that don't directly live with you, if they or someone in their family has the flu, it is very important that they do not come and visit you while they are actively sick. Okay, that is very important. That's even not even in flu season. Okay, it's very important that people think about, and sometimes you have to again advocate for yourself and say, oh, well, little Junebug has a stomach virus. Uh-oh, how about you guys come over in about 96 hours? That's okay. It's and hopefully they'll understand it and they'll respect it. And it's like if you explain to them the MS and how that flu bug or tummy bug that someone has, it's going to take you way longer to get past it and could potentially become way worse. Okay. And so I bring that point back up because I also want to say that with steroids, sometimes when we're on steroids, man, we can become like kind of mean, and it's like we don't mean it. We don't mean it at all. But I'm one. I literally, as they infuse those things in, like I sleep pretty much the entire time, and they're always like, I've never seen anyone just sleep while they're getting this. But if you're one that's never had steroids, it can change your personality a little bit, and it'll take a while for that to simmer back down. It'll be sometimes a few days before you're able to get actually a good night's sleep. Okay, so just know that that's kind of par for the course. If you've never had steroids either, know that you will taste like you've been licking on a gun or something, because you just taste this powerful nasty metal in your mouth. It's gross. Peppermint, cough drops, Jolly Ranchers, anything like that is kind of good to suck on. Excuse me, there goes that PBA. It's kind of good. Excuse me, it's kind of good to suck on whenever you are receiving the steroid infusion. Okay. That'll kind of get that taste out of your mouth, and it will sometimes change your taste buds for a little while after you receive the steroids. Just know that can kind of be par for the course with that. Okay. But again, it's important for our family members to realize that we may be a little more short fused, and that's from the steroids, and definitely it's understandable because you're getting a gram of that stuff a day, and that's some powerful stuff. Okay. So and also know too that whenever you receive steroids, that also depletes your immune system even more. Okay. So it's definitely very important whenever you're receiving steroids to make sure that you're staying clear of people whom are sick. Okay. Because your system itself is going to be down a bit because of the steroids. Go figure, because something that makes you feel so good can, in the end turn around. If you get around somebody that's sick, boy, it can get you really bad. Okay. And y'all forgive me for that moment there a while ago where I got tickled at myself. Okay. Y'all know that I ain't right. I'll be the first to tell you that I'm not right. Okay. I get tickled about stuff that I shouldn't, and that's all part of pseudobulbar affect. Okay. PBA. I'm not Danny Glover, but I'm not, on a commercial for it, but I will tell you that I have it, and I will sometimes laugh at moments that I should not laugh. Okay. So just laugh with me. Laugh at my pain. Okay. Again, y'all, it's been, I'm actually feeling a little bit better. Had to do some changes to some medication to kind of hopefully get past and through. I think it's actually allergies, because things are kind of working out for me there on that end, and I didn't have to give you all the sneeze disclaimer at the beginning. So I'm hoping that you guys are all feeling well. And again, remember, you want to get the flu shot, which is inactive, and everybody in your household also wants to receive the flu shot. The nasal mist, that is the active virus. You do not, nor does anyone in your household, need to receive the active virus. Also, remember that in a relapse, after you've had your steroids and you notice some loss of function that came along with it, it's important that you ask for physical therapy and occupational therapy to help you get through it, so that you can hopefully gain back that mobility that you lost in that function, or that we can get your new normal figured out. Okay. So thank you guys for joining me this week, and I will see you again next week here on MS&Me Radio. Take care. Bye.